Hi, everyone. Thank you for joining us today. My name is Kelly Mann, and I'm the Director of Programs here at A Time to Heal. And I just wanted to start off by just 1 second. I'm going to share my screen here. 1 sec. All right. Thanks for your patience.
What's your green?
Right here. All right. Can everybody see that?
Maddie and Dexter.
Can you guys see my screen?
Yes.
Okay. Well, before we get started, I just wanted to thank Nebraska Cancer Specialists. They sponsor all of our Create Your Best Life events, including our session today. And so Nebraska Cancer Specialists is a proud supporter of A Time to Heal and a longtime supporter at that. Together with them, we are committed to providing exceptional care and continued support to patients, families, and caregivers. So if you're interested in learning more about them, their website is right there as well. And without further ado, joining us today, we have Dr. Teri Gabel, who co-founded Drug Therapy Consultants. She's a volunteer faculty member with the Department of Psychiatry at the University of Nebraska Medical Center, and she lectures for both UNMC and Creighton University. She works as a clinical pharmacy specialist in mental health at the VA, and she also completed her psychiatric pharmacy residency, is board certified in psychiatry pharmacy practice, and also has advanced training in natural medicines. So thank you for joining us, Dr. Gabel.
My pleasure. Good to be here. Welcome, everybody. I formatted this presentation around the questions that I received in advance. So hopefully we will answer most people's questions, and I can answer the ad hoc questions as we go, or I can write them down to answer them later. I'm definitely not always going to know the answer to everyone's question off the top of my head. Disclosures, yeah, I get no money from anybody. I think the most important thing is this presentation is a reflection of my review of the literature, some of my opinion, and the information provided is not intended to diagnose or treat you or to tell you what to take. Hopefully it will just spark interest in learning more about some of the things we'll talk about today. Next. So I always get asked what's safe to take, what are the side effects, are they going to interact with the medications that I take or the other supplements I'm using, and what should I take, how do I choose what to do? So we're going to try to answer some of those today. So I ask people all the time if they use natural medicines, and a lot of time they will say no. Well, caffeine's a natural medicine, as is most of the laxatives that you use. I don't want to know who uses those. That's your business, so to speak. But we do use natural medicines in our world all the time. So it's not a new thing to most of us. We're just not always thinking about it in those terms. Next. So one of the things I always want to talk about when I'm speaking to people is how to look at purchasing an herbal product. And this can go for a supplement as well. And generally, I tell people to avoid imported products because they can put things in their products that we would not like to potentially be using. So a product from China, say, can have animal parts, insect parts, prescription medications in them. They can have all different kinds of things. And we can't read the label if it's in Chinese. At least I can't. I don't know about everyone else out there. So when we import things from another country, we can be looking at all kinds of problems that we're not even going to be able to prevent or forecast. I also avoid products that contain multiple herbs. Generally, if something has more than 5 herbs in the blend, you may or may not get enough of anything that you want to actually get an effect. So proprietary blends can be a no-no, depending on what you know about that blend and that product. Anything that says it cures everything except for garlic, because garlic does everything. It does helps with high blood pressure. It helps with high cholesterol. It helps with blood sugars. It helps with infections. It helps food taste good, and it keeps vampires away. So it's one of the only things I know of that is absolutely a cure-all. Anything else? No. Run screaming in the opposite direction. And anyone's product where they say, doctors don't want you to know about this product because it will cure you. Any kind of conspiracy advertising, avoid those things. And also double check all the health claims that you see in a magazine or on the internet with a source that's not trying to sell it to you. So it's really important that you get unbiased information. And the National Center for Complementary and Alternative Medicine, on their webpage, they have a evaluation for you to use when you're looking at web pages and how to kind of see what's real and what's not real. Also, clerks in stores are not healthcare professionals. So if you're in the store asking about a herb for a specific indication, know what you're looking for before you go. They should be able to tell you a quality product, but they shouldn't try to tell you what it is you should take. And then again, use products from reputable companies, and we'll talk more about that. When you're looking at the label, it should tell you how to contact that company. It should also give you a lot number and an expiration date, and it should tell you where it came from, the part that's used. And some herbs have a standardization that you're looking for, and that should be on the label. Also, the label should give you the exact dose you need to take. Next. One of the places we can go, and I'm not going to spend a lot of time on this slides, is Consumer Labs. And this is a subscription web page. It's not very expensive. But what they do is they take 2 different bottles of the same lot and expiration date. They have them evaluated by separate labs. And then they put that information together and tell you if something passes the quality test or not and why. And as you can see in the chart, the one that's in red would be one that did not pass. And so this can be a good place to find information about quality, but not does it work. It also got some information on how to use the product and what to watch out for. So next. Another place you can go, and this one's free. This is the United States Pharmacopia. And USP is the governing organization for quality ingredients in medications and anything that's put together. And they also do quality evaluations for supplements. And that's where you see the USP sign on some of the things in the store. Do we have a question, Kelly?
I don't have a question. Did anybody else? I didn't catch that.
Okay, no problem. So this is another place you can go. And again, this is a free webpage. Next. Another place you can go to look for quality product information is the NSF. And I always forget what that stands for, but they have information on quality and how to find products and what to look for. So there are some really good places out there to get information on quality. Go ahead and go to the next one. James Duke, who is an herbalist and a botanist, he was the grandfather of herbology here in the United States. He recommends some of these products here because he's worked with these companies and found them to be of high moral fiber and quality. Others that you see from Consumer Labs and the USP are listed on this slide as well. I have no stock in any of the companies. You are free to choose whichever one fits your needs and your budget. Next. Dosing. The label doses are targeting a 70 kilogram male. So you're going to want to adjust it up or down depending on your weight. If it says dropper, one normal pump on a dropper, a liquid version of these things, is going to give you roughly about 30 to 40 drops. And when you take 2 droppers full of a extract like that and put it in a cup of hot water, you're looking at about what you would have for a cup of tea. When you're trying things, you want to try different formulations. If the tablet doesn't work, you might want to try a liquid. If the liquid doesn't work, you might, or isn't something you can do, you might want to try a tablet or a capsule of the product. Sometimes it's just how we absorb them and how things go. Okay, next. All right. This is one of the most important things I find when we're trying medications, when we're trying over-the-counter products, when we're trying natural medicines. We need to have an objective way of knowing if it's helpful, harmful, if we want to continue to take it. So in a study of medications, the N is the number of people in the trial. So in this study, it's an N of 1 because it's you. What you want to do is document the reasons you're taking the product at baseline. That means before you start it. What are your goals? What are your symptoms? Most trials are going to be a couple of months before you're going to see the result. Sometimes you're going to start on the therapeutic dose at the beginning. So you want to do a baseline documentation and an ending documentation. Sometimes you're going to have to adjust the dose. So you're going to do a baseline, and then before you change the dose and as needed, and then a final rating. Do a scale 0 to 10. How bad is the symptom? What is the problem? Following again, you're going to take out your little slips that you've been documenting on. And by the way, once you've done the baseline, you can't go back and look at it until the very end. You never get to look at the previous rating until the very end. So take all those ratings and lay them on a table or your desk, whatever, and say, I was a 4 when I started and I'm a 4 now. Didn't work. Try something different. If I was a 4 at the beginning and I'm a 0 now, that's pretty good. If I was a 10 at the beginning and I'm a 0 now, that's wonderful. Gives you a way to figure out if you want to keep doing what you're doing or not. Also, you can document side effects that you're finding as you go. Is it something that's related to the medication or not? Next. This is just a little bit of information on herbs and surgery. Doesn't matter what kind of surgery, anytime you're having anesthesia or significant surgery, you can have risks of increased bleeding, changes in how your anesthesia works. And so it's important to discontinue herbs 14 days prior to surgery. That's just the safe way to do it. Next. One of the biggest concerns with natural medicines in oncology are how are they going to affect the chemo we're getting? How are they going to affect the therapy? Drug interactions can be both pharmacokinetic, and that's the effect the body has on the drug, how it's metabolized, et cetera, and pharmacodynamic, which is the effect the drug has on us, and that can be increased or decreased. And then we can have additive interactions, synergistic interactions, and negating interactions. So why are these things important? Is that if we know about them in advance, we can prevent the interaction or adjust the doses to take it into consideration. It's really important if we're on narrow therapeutic index medications, meaning the dose that's good is not very far from the dose that's toxic to us. And so drug interactions are really important when they surprise us. So knowledge of safety, looking at the difference between known interactions like the medication carbamazepine, which is Tegretol. We know it increases the effectiveness of the enzymes that metabolize drugs, so blood levels fall. When we first started seeing St. John's wort on the herbal scene, we didn't know that it affected enzymes at all. And people's blood levels of medications were dropping. People were rejecting organs. They were having increases in their illnesses because their medications weren't working as well. So now we know that St. John's wort increases the rate at which medications are metabolized by our body in just about every situation. So if you're on any other medication, St. John's wort is a no-no. Next. these are just some examples of the interactions in the herbs that could be involved. Some of the concerns in cancer treatment are if the therapy is creating free radicals to destroy the cancer and we're filling our body full of antioxidant type supplements and herbs, that can counter the effectiveness of the treatment. Also, if I'm on immunosuppressant therapy and I'm taking a bunch of herbs that increase my immunity because I'm thinking that'll be helpful, I can negate the benefit of my treatment. Next. Okay, I had one question on the best places, the best types of calcium, magnesium, and potassium to take. One web page to check is the dietary supplements information on the web page from the National Institutes of Health. And there is a bunch of information there. But just in general, let's look at calcium first. Next. Calcium has many uses. It can do a lot of different things for us. Whether or not it's actually helpful in cancer treatment is not really known, but we do know that we need a good supply for good nerves, good strong bones, etc. And the best form is really going to be calcium citrate because you can absorb it with or without food. You can take it any time of the day. If you're using calcium carbonate formulations, you have to take those after a meal. So that can limit your ability to take them when you want to. We do know they decrease the absorption of some nutrients and medications. So if you're supplementing, it's recommended you take it an hour before or 2 hours after anything else. And it's always best to get our minerals and our vitamins as food if we can, as much as possible. Next. As far as magnesium goes, there's several formulations that are most bioavailable, and they're listed there on the slide. It can be a very wonderful, relaxing mineral to take at bedtime. So the citrate would be nice and available at that time. Sometimes a calcium and magnesium combination in the citrate form at bedtime can be very helpful for sleep. Of course, getting it in food is a great way to get your magnesium, but a lot of us don't want to eat a bunch before we go to bed. Anything that's high in fiber is high in magnesium, so that's a good correlation to remember. Next. Potassium, it's always good to get it through your food if you can, but if you're going to use a supplement, potassium chloride is the one that's used in medicine. Watch your doses. You don't want to have too much potassium either. Next. Vitamin D is very important to all of us. With all of our sunscreen that we use, and all the limiting our ability to be in the sun, we don't really get the benefit of the sun's rays changing the inactive vitamin D in our skin to active vitamin D. So we may need to supplement. Generally, 2,000 international units a day is enough for anyone. That's probably 25 micrograms in that ballpark. It's really good for our immunity. It's good for a lot of different potential benefits as far as cancer treatment. It's really important to talk to our provider about adding vitamin D to our regimen. Generally, the normal supplementation is not an issue. It's when people try to do the mega supplementation. And there's some interesting synergistic therapeutic activity of vitamin D with some of our chemotherapy type agents. So it can potentially be beneficial to many of us. It's just knowing for sure where you're at in the process and what you're taking. Next. Okay, I had a question. I had several questions about the drug interactions with tamoxifen and Lupron. Tamoxifen works as an estrogen modulator, so it's hormone therapy, and it has changed from its prodrug state, its inactive state, to its active form by an enzyme called cytochrome P450 2D6. CYP3A4 is part of its metabolism, but it's not the rate limiting step. So it's not as important when that is affected. But when drugs affect 2D6, they prevent the tamoxifen from being metabolized to endoxifen, which is the active form of the medication. When it comes to Lupron, it's a synthetic hormone similar to one we actually produce in our body, and it basically inhibits estrogen and androgen production. It's broken down by different enzymes than the cytochrome P450 ones, and so drug interactions that involve its metabolism are not expected to occur. And there is another form of drug interaction where drugs are bounced off carrier proteins in the body, and that doesn't happen with this because it's not highly protein bound to begin with. So Lupron should have very few drug interactions that we need to be concerned about. Next.
Terry, I did have a question on that one that was submitted.
All right.
So the question that was submitted for tamoxifen and Lupron is there any supplements that can be taken for hot flashes, mood swings, or achy joints with these two, with tamoxifen and Lupron?
Go to the next slide.
Oh,
The first question I wanted to answer is there was one about, are there supplements that can replace these two drugs? And that's a no. Supplements are not strong enough to take their place. Next slide. Okay, since
you.
we don't expect drug interactions with Lupron, it's really not going to be an issue if we're going to try something like cohosh for hot flashes. So tamoxifen is basically the biggest concern. So anything that inhibits the activity of 2D6, examples of those are valerian and turmeric, can cause an increase in tamoxifen and a decrease in its active metabolite endoxifen. So when we're looking at these herbs as we go through them, when we talk about inhibition of 2D6, those would be things that we should not take if we're on tamoxifen. Increasing the activity of this enzyme is not common. It's really not thought to be inducible. But St. John's wort induces so many of these cytochrome P450 enzymes that we just avoid it with everything. Anything that's a phytoestrogen, which is just a plant-based estrogen, that's kind of like a 40-watt bulb if your natural estrogen is like a spotlight, big, huge, bright light. So these can have some benefit in hot flashes, but they can also be negative if someone's taking tamoxifen to calm down the estrogen in their body, if they're taking Lupron to calm down, you know, the production of those things. So phytoestrogens, depending on the type, can be a negative for us when we're taking tamoxifen, or if we have a hormone positive sensitive cancer. So no isolated isoflavone products. Phytoestrogen herbs we would like to avoid would be ginseng, dong quai, red clover, soy, isolated isoflavone products. So if we go to the next slide.
it looks like Kim had a question in the chat box. Did that answer your question, Kim, or otherwise I can ask the question?
Actually, the drug that I'm on isn't tamoxifen, it's anastrozole.
So the question that Kim had asked is a similar question. Can she take black cohosh or an herb for hot flashes while on that medication?
On anastrozole?
Yes.
There aren't very many drug interactions with anastrozole. So black cohosh is probably fine. The concern with black cohosh for most providers is that we're not convinced 100% that it doesn't have a phytoestrogen component. That's part of why it works. So that's part of the concern. Most of the research I have read is that it works by adjusting neurotransmitters, similar to the antidepressants I have on this slide. We know we can use flaxseed because the phytoestrogens in flaxseed are anti-estrogen in activity. So black cohosh is kind of a maybe, depending. Someone had asked about mood swings, and I wasn't quite sure if they meant like big mood swings or just irritable to happy to happy, sad. But if you have major mood swings, like in bipolar affective disorder, then lithium would be the most natural thing that I have available to you. As far as achy joints, glucosamine and MSM are not metabolized. They're not going to affect anything. And so potentially they can be helpful. MSM is more likely to help with the pain. Glucosamine is more likely to help with just the health of the joint. And if we go to the next slide, here's some little bit of more on black cohosh. Again, we're always getting more information on black cohosh, and the most recent drug interaction article I read basically did not consider it to be a problem. But we just don't have black and white study evidence. And so it's kind of like where you are, but it's not going to interact with your medication, the anastrozole. Did that answer your question?
Yes, it did. Thank you so much.
Mm-hmm. Next slide. I was asked about an interaction with the Parp inhibitors. For those of you who don't know what they are, and I was not familiar with them, they basically keep the cancer cells from fixing the damage caused to them by the therapies. And those are some of the most common versions. And if you go to the next slide, as far as drug interactions with these products, I'm not going to try to say those names. The top one has its metabolism through the isoenzyme 3A4. So anything that inhibits the activity of that enzyme will result in higher levels of that drug. Anything that decreases the activity of that or increases the activity of that enzyme will decrease the effectiveness of that medication. With the next one, there's no involvement with the CYP enzymes at all. It has its own little enzyme that it goes through the enzymatic system, and that's not induced or inhibited by herbs and supplements. The third one on the page, again, 2D6. So anything that inhibits the activity of that isoenzyme will result in higher doses of that product. And if we have a substance that does increase the activity of that enzyme, we'll get a decrease in the level of that product. The last one has minimal involvement with enzyme metabolism, so it's really going to have very few drug interactions. Next. This was an interesting question for me because I hadn't really looked at it, but low-dose naltrexone in the treatment of and management of cancer is something that they're actually doing some major research on. I've given a couple of references on the bottom there of this slide. And it seems that it can stimulate immune cells, so improving our immunity, decreasing inflammation. It might be important to know that if it's going to improve our immune system, if I'm already on something that I want to use to suppress my immune system to treat an illness, it might be a contraindication. But it does seem to have some really interesting activity as an adjunct in the management of cancer, in the treatment of cancer. And anything that can cause apoptosis or cell death of a cancer cell, we're happy to see being researched. Next. I was asked if I recommended coffee enemas, and no, I don't recommend them to anyone. The evidence of effectiveness as a detox product or process is minimal to none, and the safety is highly questionable. Next. As far as neuropathy, one of the interesting supplements. It's not an herb, it's a supplement out there that is used in diabetes and for peripheral neuropathy. Secondary to that issue is alpha lipoic acid. Mechanistically, they think it's because of its antioxidant activity, but there could be other mechanisms as for why it's helpful. So it could be worth a try. You would need to look at your treatment. If you're on something that needs to have those free radicals to be effective against the cancer, then as an antioxidant supplement, it might not be something you want to use. So again, it's going to depend on what you're getting treated with and where you are in the process. Next. Mushrooms. Someone wanted to know about mushrooms. I think they're nice and tasty, but not all of them are edible. They have multiple things that they can do depending on the mushroom you're looking at. Like maitake can help the immune system. It may be helpful with having an anti-tumor action, but it also can decrease, is also been shown to decrease doxorubicin toxicity. So it might be something a person could take. It might be something helpful. Again, anything that improves the immune system is going to be good if we're not on something that suppresses the immune system as its mechanism of action. Again, reishi mushroom has that antioxidant activity, so we would have to know what our medication is doing as far as do we need to have those free radicals to be effective. It also does have some ability to inhibit some of the enzymes that metabolize medications. So again, that would be a concern. Again, a lot of these concerns are dose related, and how much you would have to take for these actions to occur is not known. So it would be something that would be a potential interaction, but not necessarily contraindicated issue. So it depends on the mushroom. If you're just doing them for health, sometimes you can get what they call as a mushroom mix, where you get a blend of the healthy mushrooms, and that can be something to take. Again, depends on where you are in the process and what you're getting. Next. Now, flaxseed is something that is of interest to a lot of us because it does contain phytoestrogens. These are the lignan variety, and that means that they are anti-estrogenic. And so it interferes with estrogen activity. So it does not it's not contraindicated with your medications that are affecting estrogen levels. It is, when you're using flaxseed, it's important to use the actual seeds, and you must grind them to have the effect, because you need the lignans are not in any of the oil products. That's just the omega-3 fatty acids that are helpful for other things that we like decreasing inflammation, helping with cholesterol and those things. They're high in fiber, so they're high in magnesium, but they're also a nice laxative. And so when you're starting to use ground flaxseed, if you're going to do that, you can grind it and put it on your oatmeal. You can grind it and put it on a variety of other things. But start low and increase slowly, because diarrhea is one of the major side effects of using too much too fast. And next. There are some interesting studies looking at its potential benefit in cancer. And again, lignans are not contraindicated in breast cancer survivors, not contraindicated with tamoxifen or other medications in that area. So there's a lot of research being done with flaxseed in cancer. Next. Okay, one question was, what is the word on soy? We want you to avoid the isolated isoflavone concentrated products, those little pills that say they contain the isoflavones. Soy foods themselves are not an issue. In fact, they recommend for healthy diets that we get 1/3 to half our daily protein in plant-based protein, and soy is one of those. So having soy foods in moderation is not a problem. Just don't use the isolated isoflavone products. And those can be from a variety of different herbs. And I think, what was the one I saw? Red clover or something like that. The other day was the basis of one of the isoflavone products. So have your tofu, have your soy milk, have your whatever you like. Don't fret it. Next. Okay, this table is kind of busy. The presentation will be available afterwards. The important thing is here, someone asked about things to help with no energy, feeling fatigued. Adaptogens or herbs that help support our adrenal system, help support us to deal with stress, whether it's psychological, physiological, or whatever. So mental, physical, whatever. May improve our ability to think clearly. The Panax species are the traditional ginsengs that we think about. The American ginseng has most of the studies in cancer survivors. Unfortunately, it does seem to have some phytoestrogenic activity, and so it's not for use in hormone-sensitive cancers. So ginsengs themselves may not be your answer, but take a look at ashwagandha, which is Indian ginseng by common name. It does not appear to have phytoestrogens in it that I have been able to find. So depending on, again, where you are and what you're doing, it may be something that could help with relieving stress, giving you some benefit. Next. I'm just going to go through rhodiola quickly because it is one of my favorite adaptogens, helping again with supporting us when we are physically and mentally exhausted. It may have some benefits in some cancers. Again, that's preliminary information. It increases the production of our neurotransmitters, the chemicals in our brain that help us deal with stress and help with depression and those types of things. There is a standardization that we want to look for. Next slide. It does improve your immune system, so we don't want to use it in immune suppressant therapy. And it may have the ability to activate a manic episode in people with bipolar depression. So we want to be careful there. Preliminary data says it may have effects on the 3A4 isoenzyme and the P-glycoprotein, which is a protein that's in the lining of our intestinal tract and in other membranes in our body that balances how much drug gets into the system. And so I have not been able to find any more specifics on that recently. So again, it's just a caution as far as what we're taking. Next. I was asked if you could take turmeric if you were a breast cancer survivor. In general, yes, it's got some potential benefits to us as individuals. If we go to the next slide. The concern with turmeric is the potential for good and bad drug interactions. It also thins the blood, so if you're on a blood thinner, that would be a concern if you take medication doses. If you're just eating it in food, it's generally not a problem. Now, it may have positive effects on the medications listed on this slide, but it can be a negative for cyclophosphamide, no interaction with docetaxel, but it may affect the 3A4, 1A2, and 2D6 enzymes. And so that would be inhibition. So that means that drugs metabolized by those enzymes would have higher blood levels when you're taking therapeutic doses of turmeric, potentially. I can't see what that bottom one is.
The one that I see, it says may inhibit glycoprotein.
Okay. Again, that's that P-glycoprotein is the efflux protein that's in the lining of the membrane of your intestinal tract. And if it inhibits that, then you absorb more drug than you thought you were going to absorb, because the efflux mechanism, again, balances how much comes in and how much stays out. And if that's not there to balance that, then you absorb more drug than you were expecting. And that can lead to side effects and toxicities. Okay, next slide. The next two herbs are some that might address that cancer brain, that foggy brain that we get during treatment. This one is pretty mild, pretty well tolerated, doesn't have a lot of drug interactions. So it's a potential. So Brahmi is something that's used in the management of memory problems in other disease states. Next. Bacopa is also potentially helpful in cognitive impairment of a variety of different types of things. Again, it's pretty well tolerated, may have a few more gastrointestinal side effects than Brahmi. Very few drug interactions that we would be concerned about in the management of cancer. But again, we'd have to check it out in more detail. But these are two possibles, as well as the adaptogens we mentioned earlier. Next. I threw milk thistle in here because it is one of the best herbs for the health of our livers. And so it's something that can be very beneficial. It may have its own ability to be a negative for cancer, take care of that cancer. It's got positive effects on the liver as far as regeneration, improving the health of our liver. If we go to the next slide. Again, it has a standardization that we want to look for in the products that we have. Drug interactions are starting to be something we're going to look at. It does increase the clearance of estrogen, which may or may not be something we want, depending. And then it does inhibit, decreases the activity of the isoenzyme 2C9, which is not one of our major enzymes as far as drug metabolism goes, but it can creep in there and affects us when we're not thinking about it. And then it affects glucuronidation, and that's one of the final steps of clearing drugs from our system. And we think it improves glucuronidation so that we have increased clearance of toxins from our body. So that would be a good interaction. Again, all of these things might be dose related, and we'll have to think about it. Kava was asked about, and in mental health, it's used for anxiety. It can also help with sleep. It seems to work through the GABA system, which is that chemical in our brain that calms us down, calms systems down. The concern with Cabo in most recent years has been cases of hepatotoxicity, meaning liver damage, where people have, unfortunately, some died, some had to have liver transplants. It's been banned in many countries. The concern was whether it was the kava itself or a contaminant in the products that were used. You don't see liver damage and issues like that in the countries where it's used chronically in its natural form, where they chew the root, they use it in its naturally in its base form. So if someone's going to use Cabo, my recommendation is to ignore the standardization that you see on this slide and just use the whole root product, something that is just the ground root, if you're going to try it. Next, valerian. Again, valerian is a very good anti-anxiety and sleep herb. It seems to help prolong sleep, not necessarily help you fall asleep. It's the additive ingredient in Sleepy Time Extra tea that you see in the grocery store. Again, drug interactions, it inhibits the 3A4 enzyme, so that would be a concern with drugs that are metabolized by that enzyme. There's a report of coma when someone added valerian to their alprazolam, which is Xanax, and Xanax is metabolized by the 3A4 isoenzyme. So knowing that now explains that case report. There have been concerns about hepatotoxicity, again, liver damage with valerian. Again, we think this is because of a contaminant, not because of the medication itself, but it's something that you would need to take into consideration depending on your situation. Next. Melatonin has some interesting things that we know it can be helpful for. We have been looking greatly into how it works and why we think it helps. It does increase that calming chemical in our brain called GABA. So it has the ability to help with sleep. Again, this is something we produce on our own, and levels of it in our body grow and go down depending on the light and dark of the day. And our production of melatonin can be somewhat screwed up in a lot of ways because of all the lights that we have in our houses and the brightness of the lights and how late we keep the lights on. And if we don't have enough dark, we don't get enough melatonin production to help us fall asleep. Next slide. All right, so generally well tolerated. Drug interactions, again, additive to CNS depression, in other words, additive sedation. Fluvoxamine is an antidepressant that changes our own melatonin levels. And so that could be something where supplementation of melatonin could counter that negative effect on our own melatonin levels. Dosing varies depending on why we're using it. Next slide. Now, aromatherapy is something that I've just started to look into more for helping with different problems. And it's basically the use of the essential oil of an herb to affect our physical health and our mental health. These essential oils are very, very concentrated products, and most of them should not be taken orally. And when they're used on the skin, they're diluted with a carrier oil. And basically the goal is to alter how our body is reacting to stress, how it's reacting to disease, how it's reacting to a variety of different things. The cautions here: if you're allergic to the herb, you don't want to use the essential oil. Specific oils may not be used in pregnancy, so that's important. Some of these oils have phytoestrogen-like properties, so they would not be something to use if you're trying to not have a lot of estrogen in your system. Babies are very sensitive to the aromas of these things, so we don't recommend aromatherapy in babies. Next slide. These are some of the very common aromatherapy oils for a lot of different things. Frankincense for relaxation. It's also in products, and you can dilute a drop of the oil in 4 ounces of a carrier lotion, and you can use it on your skin for better skin health. A lot of these are have a variety of uses. Next. Okay, just kind of some concluding thoughts. We have a whole host of things we need when we're talking about a natural approach to health. Our mind, body, spirit connection is so important. And natural medicines need to be part of a holistic approach, not just an isolated aspect of trying to deal with our health. And which ones we need is going to be very individualized. So there's no one way to suggest a bunch of, herbs that you should all take if you're a cancer survivor. It's always going to be very individualized. Last slide. Concluding thoughts. Natural sounds better, but it's not always the safest. Think of arsenic, and if you get bit by a rattlesnake, it's not a good thing. Botox is not the same thing. Natural medicine is not always cost effective. These products are very expensive. So we're talking about hot flashes. There are $4 a month antidepressants that can be used to treat hot flashes very effectively, very safely. That might be your best bet in the long run. What's good for you might not be good for someone else, and vice versa. So this is the person that's saying, here, you got to take this for your health. You got to do this. Just say no. And then if you want to look at the information regarding that product, you can do that. So double check the information. If it sounds too good to be true, it probably is. Some interesting web pages are evidencewatch.com and quackwatch.com. These two look at the evidence in the data out there. They look at whether it's good information or bad information, and if it's a quack or a scam or just bad for you. So that's the end of my presentation.
Thank you so much, Terry. We had a lot of questions that were submitted, and you did a really wonderful job at going through each of those questions. So thank you, thank you, thank you. I would like to open it up if there are any questions that you guys have right now in the moment. If you want to submit them in the chat box, or if you want to come off mute. I think Kathy just came off mute. Did you have a question?
Did, and I did have to step away for a few minutes. So if this was asked before, I apologize. Will we have access to the slide presentation today at any time?
Yeah, yep. Terry is very generous to offer this to everyone that's attended. So I will go ahead this week and send out a follow-up email, and I'll have the slide deck included in that. It looks like there's a clarifying question on milk thistle. It says, could Terry confirm, did she say that this was safe for hormone positive breast cancer?
It seems to increase the clearance of estrogen that we have in our bodies. So if decreasing estrogen is okay, then it's, that's not something we want. We don't want excessive estrogen in our systems if we have estrogen sensitive breast cancer. The degree to which it decreases our natural or decreases levels of estrogen is not really known. So that would be a potential thing to monitor. It may be something that's going to be a problem, and it might be something that's not going to be a problem. I just don't know a percentage yet.
Cindy had a question. Is taking vitamin E an issue for someone who had breast cancer?
Taking vitamin E in the normal supplemental doses up to 100, it's up to 400 international units is fine.
Other questions? Feel free to come off mute.
You can't see me.
That's okay, Judy. We can hear you.
Okay. I don't know if you've had a chance to look at this, but how does the COVID vaccines, do they have any impact I know that my oncologist wanted me to take them, but I don't know if they impact with what I'm taking, because I find, as much as I love my oncologists, they don't know anything about what you said. They really don't, because I've talked to them about it. And they just say, okay, go ahead and take it. And I also want to thank you for your presentation. It was wonderful. And I too find rhodiola one of the best things to take.
Yeah, it's in my regimen. I admit that. The COVID vaccine is fine in cancer survivors in active cancer treatment. It's not going to take anything. It's not going to cause a problem.
Thanks, Terry. We had a question submitted. Is there anything that can be taken for a venous ulcer?
A venous ulcer?
Thank you.
That I don't know off the top of my head. There are several healing herbs for skin. That could be something that I can add as a PS. So,
Thanks, Terry.
yeah.
Our session is scheduled until 11:15, and so feel free if you guys have more questions. We have Terry for this short amount of time. Looks like Cindy had a question. It was she was recommended to take fish oil for joint pain with anastrozole and Lupron. And so her question is that what are your thoughts on that?
Fish oil for joint pain.
Mhm.
Primarily, fish oil is used because it's an excellent source of omega-3 fatty acids, which is going to decrease inflammation. Taking fish oil with other medications, the biggest concern is if the medications thin the blood. I don't believe either of those thin the blood. So taking fish oil is good for you. The biggest concern is as you get up in the higher doses is that it does thin the blood. If you are taking fish oil, my recommendation is to make sure that the ingredients, the EPA and the DHA, those amounts in the capsule equal as close to 1,000 as you can get. Not just having 1,000 milligrams of fish oil with like EPA at 200 and DHA at 150. That's not helpful. So, and it's not in this presentation. So again, the combination of those two ingredients should be as close to 1,000 as you can get into product you buy.
Thank you.
Mhm.
Anybody else have any questions that they want to come off mute for? It looks like there was a question, is there anything that can be taken with Cabo meds? And I apologize, I know that I'm saying these wrong.
That I don't know. I can look and add that to the PS.
Okay. And with these, I will connect with Terry to send some follow-up answers and some resources as well. So thanks for the questions. These are great.
Mhm.
Anybody want to come off mute? Any other questions that anybody has while we have Terry?
There's no dumb question. There's probably 6 other people in there going, what about blah?
And if you want, you can submit a question directly to me in the chat box. There's a way to do it anonymously. There's a to, and you would just select where it says everyone, and then you change it to say to Kelly Mand, who's myself, and it'll say that I'm the host. So if you want to submit one anonymously, you can do so as well.
I have a question about turmeric and pepper and garlic and things like that. Is it true that like some of those things are better when taken together?
It is. When you're going to take turmeric, you need to take it with black pepper. So most of your products do have that ingredient as part of the product. So when I do take turmeric and my product has pepper, I don't remember what brand I have right now. I change it. I think it's the Costco brand because I do a lot of my Costco stuff. With garlic, if you're taking the tablets in capsules, you do not want them to be heat treated to get the smell out. So if it says no smell and you need to investigate how they got the smell out, because if they heated it they've probably killed half of the good stuff in it, because heat kills some of the active ingredients in garlic. If you're cooking with garlic to get the benefit, to keep away the vampires, etc., you want to chop your garlic, mash it, whatever you're going to do, and let it sit for about 10 minutes before you cook with it, because there are inactive ingredients in garlic cloves and active ingredients in garlic cloves. Smashing them and releases the chemical in the clove itself that turns the inactive ingredients to active ingredients. And so then when you add it to your food, you're more likely to get the full benefit. Once you've cooked your food, though, some of those things might be cooked out. So at the very end, you want to add some more of that crushed garlic just to kind of bolster the healthiness of that dish. And then somebody asked about multiple vitamins. There's a lot of debate on multiple vitamins and whether you need one or not. If you eat well, you probably don't. And if you don't eat well, me, you probably do. Which one to take? There's a good review on the Consumer Labs page. They review multiple vitamins all the time to see which ones are continuing to provide what we need. The thing to remember is over-the-counter medications, vitamins, minerals, and those things that are sold in stores are not regulated by the FDA. So as with herbs, the quality of those things can vary. So it's really important to check out those things.
Thanks, Terry. We had a question that asked where you purchase your herbal medications.
It depends. I go to Natural Grocer. I go to Whole Foods. I generally go to the natural stores. Sometimes I go to No Name Nutrition. I don't have a favorite. I usually just go where the prices are the best.
Thank you. And we have a lot of questions coming in, so just bear with me. Do you know anything about juice plus supplements?
No, I don't.
Okay. Another question on Lupron and anastrozole. This person has lots of joint pain. Do you recommend the MSM? Can you talk a little bit more about that or anything else? This person has tried tart cherry and Claritin.
MSM is a natural sulfur replacement, a source of sulfur replacement in many of the mechanisms that go on in our bodies, including the health of our joints. It can help decrease inflammation, and it's known for helping with pain in joints. So I think it's worth a try. Sometimes it's also going to be very good for the health of your nails and your hair.
Okay. Thank you. Thank you, Terry. This is all very, very helpful. We really appreciate your expertise. And I'm seeing some head nods. Okay, another question that I received, it says, does tamoxifen have any known interactions with coffee and tea, green, black, herbal, such as ginger? Those are just the types of tea. But the question remains, does tamoxifen have any known interactions with coffee and tea?
It will not interact with coffee because coffee is metabolized by 1A2, not B6. Tea, depending on the amount, of course, it depends on the amount of tea. Tea can affect enzymes. I don't remember the ones off the top of my head. But if you're drinking tea just normally, you're probably not going to have a problem.
Okay.
If you overdo your tea, you're going to have problems with all kinds of stuff. So normal intake of tea and coffee is fine.
Okay. Okay. Another question, why are some multivitamins labeled no iron?
Generally, as we get older, we don't need to supplement iron. And so that's why some will say no iron. Women, as we get older, we don't need to supplement with iron unless we have anemia. So they will say no iron because it's not something we need to have in our product. Some illnesses don't want you to have iron. Iron will, when you have calcium and iron in a product, sometimes they'll bind together and you won't absorb either. So calcium and iron should be separated if you're going to take them together, or if you need to take them on a daily basis, don't take them at the same time. So it could be a variety of reasons. Sometimes they'll say no vitamin K. That's because if you're on warfarin, you can't have vitamin K. So the product, the multiple vitamin you'd want to take would be one with no vitamin K.
Okay. Another question that I received, and we are going to wrap up in just a few minutes, but another question that I received, it says, have you heard of IV chelation therapy? It's CHELATION.
Chelation therapy.
Thank you so much. The question is, if you've heard of it, what are your thoughts on it, or any other information?
I've heard of it, and then several years back, it's been a lot of years back now, we did state of Nebraska did an evaluation of IV chelation therapy. There are some things that might be good for it. In general, not going to hurt you, if I remember correctly, but I haven't looked at the most recent data. Again, it's going to be something that on an individual situation and what type of chelation therapy you're talking about, because there are several different versions as to whether or not it would be a good thing for an individual.
Thanks so much, Terry.
Mhm.
Those are all of the questions that have been
I have a
submitted.
question about vitamin C infusions. Is that just kind of like a fad, or is there anything to that?
Vitamin C, what?
Infusions.
Vitamin C infusions, that's a fad. Vitamin C is so absorbable that I'm not sure why you would infuse it.
Thanks, Terry.
Yeah.
Those are all of the questions that I have, unless anyone wants to interrupt me for a last question. But thank you so much, Terry. I have learned so much. I know others have as well. This has been very, very helpful. I really appreciate your expertise on this. Yep, we have some in the chat box, people saying thank you so much. So thank you so much, Terry. Our next Create Your Best Life event is scheduled next month. It's on September 25th, and we're going to be talking about careers in cancer. So if you're returning to work, if you're looking for work, or perhaps if you've been working all along, we're going to kind of address those topics related to working during a cancer diagnosis and treatment and so forth. So thank you, everyone. Thank you for joining us. I will be in touch with each of you this week with some follow-up information, and Terry will be providing some follow-up as well to me to provide to you guys. So getting a lot of thanks in the chat box. So thank you, Terry. This has been very successful. I think everyone is very thankful for all of your expertise. Enjoy your Saturday, everyone.
Thank you.
Yeah, thank you.